Hi everyone, welcome to Coffee Chat. I'm Liway Cabrera, your host, and today we're diving into an important initiative from the Women's Resource Center, which is the W.A.G.E project or Women and Gender Equality Project. So joining me today is Jamie Brown, the project coordinator of the W.A.G.E project. So welcome.
Yes, thank you. Thank you for having me.
Yeah, and before we start, maybe you can please introduce yourself first, your role, the Women's Resource Center, and maybe a brief overview about what the Women's Resource Center is.
Sure. So I am Jamie. I am the project coordinator at the Women's Resource Center. And the Women's Resource Center is based out of Brandon, but we do serve the West Van area. We have free programs and services that support women, children, and youth, and gender diverse folks who have experienced gender-based violence. So that includes domestic violence and sexual assault. So we have free counseling services, we have an advocacy program, we have a drop-in program, which includes our daily breakfast program as well. And then in our drop-in, you can also get hygiene supplies, so folks can stop in and get those much needed supplies. Okay. We also have a monthly legal clinic. We actually have two different legal clinics. One is a family law legal clinic, and then the other one is specifically for sexual assault. We also have some staff members who are protection order designates. So if somebody is needing a protection order, we can help them with that service as well. So walk them through the application process. We also have, we can also help folks with third-party reports too, and kind of navigating that process. So a lot of different programs.
Okay.
Yeah.
So it's not like specifically just women. So you mentioned gender diverse folks.
Yeah, so anyone that self-identifies as a woman,
okay.
can come in and utilize our services, as well as children and youth too.
Ah, okay. Yeah, that's interesting. So let's dive into our focus discussion today, which is the W.A.G.E project. Yeah, can you provide an overview about the project? Like
sure.
Its objective, scope?
Absolutely.
Yeah.
So the W.A.G.E project, Women and Gender Equality Project, so it is a research-based project, and we are gathering information and data from service providers who work with survivors of gender-based violence, as well as survivors themselves. So we are visiting rural communities. There's 8 that we have identified in this project, and we are visiting those communities to gather that information. So we're hoping the objective or the goal at the end of the project is to gather enough data that we'll have a final report, and we'll be able to hopefully put some supports in place and kind of some solutions at the end of it as well, is always the hope from the Women's Resource Center.
Yeah, how did you identify the areas maybe?
So we have 8 different communities. So I can name the ones that we'll be visiting. So we've already been to Killarney. We're here in Nipawa, and then we are also going to Minnedosa, Verdon, Carberry, Shoal Lake, Hamiota, and Pilot Mound. So those are the 8, and we kind of, based on geography, so kind of spread out through Westman, and then also kind of looking at the Women's Resource Center, and like I said, we do serve the Westman area, so kind of the places that we've noticed supports are needed.
Okay.
Yeah.
And where does the funding comes from here?
So this is
the
a
project,
federal funding.
Oh, this is a federal.
Yeah, government of Canada.
So there are also other provinces that are also doing this.
Yes.
So aside from.
Yes.
Okay. So it's all over it's all over Canada.
Yeah,
so that's good. So will it be consolidated, or how would that work? Like the study.
Yeah. The results there'll be a final report at the end. So that will be all of our findings through our focus groups and through our surveys that we're doing to gather that data. It will be consolidated into a final report at the end that will be published.
Oh, okay. So it will be published by the federal government.
So we'll publish it as the Women's Resource Center.
Yes. Okay. So there will be separate.
Yes.
Okay.
Yeah.
Okay. Yeah. So about the research methodology. So you mentioned about the focus group discussions. What other methodologies are you using for this
For
study?
sure.
Yeah.
So we're doing surveys as well. So kind of how we're doing it with each community is we'll go out to an initial meeting and we'll meet with stakeholders, so different service providers from different agencies, and kind of host that initial meeting to introduce ourselves, introduce the center and the project, and ask a few questions to just kind of see a little bit what's going on in the community in terms of gender-based violence and how survivors are being supported right now and kind of what the gaps are. And then we set up the focus groups, so we'll come back and conduct the focus groups, and like I said, we'll do kind of two different ones, one with the public and one with those stakeholders again. And then we're also doing our surveys, so people have the opportunity to fill out the surveys at the focus groups, but they can also fill them out even if they don't attend the focus group, so we can always send them out as well to gather that information that way.
Okay, so the surveys are sent to the participants. How about those who can't attend the focus?
For sure.
Yeah.
For sure, yeah. So our surveys, again, we have two different ones. We have one survey for service providers and one for community members or the public. If you're not attending a focus group or a meeting but still want to complete a survey, I can just email it out for it to be completed that way, and then it can be submitted back to me. So we can always gather that information that way.
Oh, okay. So there's also an opportunity there.
Yes.
If just in case you can't attend the. So how do they contact like you?
For sure.
If they want to.
Yeah, so
submit the survey,
by phone or email,
Definitely.
they can always call the Women's Resource Center, our main line, and get a hold of me that way, or by email as well, and I can send out the surveys via email.
Okay.
Yeah.
Okay. So based on, so you have you went to other areas already. So what are the issues and concerns maybe that were raised based on those?
Yeah. So kind of a couple of the things we've been hearing so far, travel and transportation being a big barrier to access services. So this project has a focus in rural areas, right?
Yeah.
So a lot of the services are in Brandon or in Winnipeg in the bigger centers. So travel and access to transportation can be a barrier for some folks to come in to the larger centers to access services. And also having to access multiple agencies to get support as well. So not really having that kind of one place or that one hub to get a lot of different services kind of all at once. So it can be a lot of appointments, a lot of travel, and it's not always accessible. So yeah.
So those that you visited are all the victims, or survivors, or just the other stakeholders that are involved that you were mentioning?
Yeah. So far we've kind of talked to both groups.
Okay, both already.
Yeah.
Okay. You when you mention stakeholders, who are those? Maybe that's interesting to know as well.
Sure. Yeah.
Who are
So we've spoken to in our initial meetings and then in our service provider focus groups. We have spoken to folks who work at different social service agencies that support survivors.
Okay.
So some of those include mental health or public health, child and family services, RCMP. So those are just to name a few. Yeah.
Oh, okay.
Yeah.
Yeah. So good to know that those are the barriers. Yeah.
Yes.
That they are facing. So based on the study, when we have identified the barriers, what would be the will there be a response from the government to address those gaps? How would that work? Yeah.
Yeah, I mean, that is the hope. That's always the hope with anything that we do at the center, whether it's this project or other programs and things like that. Everything's depending on funding.
Yeah.
So it's not a guarantee, but that is always the hope, and that we will be able to have funding in place afterwards to put some supports in place and some solutions in place. So yeah, it's always the hope.
So that's the hope. So after that, so where would we see after this? When will be the result?
The publication.
Yeah, publication. Yeah.
Yeah. So probably. The project runs until next March, so about another year, and we're kind of planning to gather all of our data, travel out to every community that we're going to by the end of the summer, and then everything will be consolidated. All of the data will be put together after that, so maybe by the end of the year there might be hopefully a publication at that point, and then we'll publish it probably on our website and our social media pages. Yeah.
Oh, okay. So So the other, you mentioned that this is a federal funded project. So how about the results of the other groups? Will the,
I'm
how
not
would-
that I'm not too sure
okay.
about. Yeah, because I'm sure
Mhm.
there's quite a few different projects and maybe different levels and scopes of the project as well. I'm not sure if they're all the exact same. How those will be published, but yeah.
So there would be like different studies. It's not the same for all the.
I don't think so.
Okay.
No. Yeah, I'm not
Okay.
too sure what the other kind of WA.G.E projects look like,
Okay,
but
okay.
yeah,
But for Westman, this
Yeah.
is the study.
that's right. Yeah.
The WA.G.E project
Yes.
for Westman. Okay.
Yeah.
Okay. That's good to know. Okay. So I think we're almost at the end of our interview. Any final message to our viewers who are watching
Yeah.
right now?
Yeah, I think that if there's anyone watching or listening that would like to contribute to the project in any way, whether they work at a social service agency that supports survivors, or they're a survivor themselves or a family member that's been impacted by the violence and could contribute to the project and would like their voice to be heard, please reach out and contact us. You can always call the Women's Resource Center and get a hold of me that way, and we can do surveys over email or anything like that, so your voice is heard and you can contribute to the project.
Okay.
Yeah.
Yeah. Thank you so much, Jamie,
Of
for
course.
visiting us today, and good luck to your focus group discussion later.
Thank you.
Here
Yes,
at
thank you for
Dipua.
having
So
me.
yeah, hopefully this will be when you watch this, it's already done. So, but hopefully people will go there tonight to
Yes.
to
Yes, we're really hoping
Help
some
with-
people come.
yeah, yeah. So thank you, Jamie, and thank you everyone for watching us today, and we'll see you again on our next episode of Coffee Chat.